If your child wakes up with an uncontrollable leg cramp, don't worry. It's more common than you think. And although it can be painful for them, it's not usually anything to be concerned about. In fact, we're going to talk about the most common reason why children get these cramps in this video. But first, if you want to help your child get better sleep, feel more energetic during the day, and become unstoppable, please hit that subscribe button. We release 2 new videos every single week on how to improve your child's health, development, and overall well-being. Now, back to the topic at hand. When my daughter was around 4 years old, she would occasionally wake up in the middle of the night crying and holding her calf. As a parent, this is concerning when it happens frequently. However, they can be quite painful and may wake your child up in the middle of the night. Another type of cramp that children may experience is a neuromyopathic cramp. These cramps are caused by a problem with the communication between the nerves and muscles in the legs. This can lead to muscle weakness and atrophy, as well as pain and cramping. In some cases, this condition can be caused by an underlying medical condition, such as a vitamin B1 or magnesium deficiency. The most common type of cramp is called a benign familial nocturnal leg cramp. When the muscles in your child's legs aren't used regularly, they can become stiff and more prone to cramping. Just make sure your child is getting enough exercise each day, according to the American Heart Association. Children should get at least 60 minutes of moderate intensity exercise most days of the week. This can include activities such as running, biking, swimming, or playing sports. This is especially true if your child spends a lot of time sitting down, whether it's at school, playing video games, or watching TV. If your child has been diagnosed with one of these conditions, make sure to follow their treatment plan closely to prevent leg cramps. Making sure your child is well hydrated, getting enough exercise, and wearing comfortable clothing can go a long way toward reducing the number of leg cramps they experience. First, make sure they're in a comfortable position. They may find it helpful to lie down on their back with their legs elevated. You can also try massaging the cramped muscle to help relax it. If the cramp is severe, you may need to apply a cold compress to the affected area. In some cases, you may need to call your child's pediatrician for further assistance. Stretching can help relax the muscles and reduce the likelihood of cramping. There are several ways to stretch the leg muscles. By understanding the most common causes of leg cramps and taking steps to prevent them, you can help your child get the restful sleep they need to stay healthy and active. And as always, thanks for watching, and I hope you come back soon. A simple standing calf stretch can be done by having your child stand up and lean against a wall with their legs straight. They should then bend one knee and bring their heel towards the ground, holding the stretch for 15 to 30 seconds. Now that you know the basics, let's explore the most common cause of nocturnal leg cramps in children. When your body is dehydrated, it can cause your muscles to become inflamed and contract rapidly, leading to a cramp. Some of the medications that are most commonly associated with leg cramps include diuretics, statins, and some high blood pressure medications. If you suspect that a medication is causing your child's leg cramps, talk to their pediatrician. They may be able to switch your child to a different medication that has fewer side effects. This is especially true if your child hasn't drunk enough water before going to bed. This can be done by having them sit down with their legs extended in front of them. They should then use their hands to pull their toes towards their nose, holding the stretch for 15 to 30 seconds. Caffeinated drinks like soda and tea can cause your child to lose fluids through urination, leading to dehydration and cramps. If this is the case, make sure to take extra precautions to keep your child hydrated, such as bringing them water on hikes or during other outdoor activities. So it's best to avoid giving your child these drinks, especially before bed. It's important to note that even mild dehydration can cause cramps, which is why it's important to make sure your child is drinking enough fluids throughout the day. And spoiler alert, it's not what you think. This is an inherited condition that causes painful leg cramps while sleeping. Though it's not completely understood, scientists believe that the cramps are caused by a problem with the nerves in the legs. Well, first thing is to make sure they're drinking enough water throughout the day. You can also try giving them a glass of water before bed. In addition, you can try adding electrolytes to their water to help replace any lost minerals. Electrolyte drinks can be purchased at most grocery stores and are often flavored to make them more appealing to children. And even though my daughter was seeing a pediatrician, there were still many nights where we were worried that something serious was wrong. After doing some research and consulting with other medical professionals, I found out that this condition is more common than I thought. It's called nocturnal leg cramps, or nighttime muscle cramps. And although they can be very uncomfortable for your child, it's usually nothing serious. When you have a leg cramp, you may see the muscles in your child's lower leg tighten and contract rapidly. And although many people experience leg cramps once in a while, it can be especially worrying if they're happening frequently or almost every night. This can make it difficult for them to move their foot or lower leg. The cramps can happen in one leg or both, and they may also affect the arms or other parts of the body. Cramps typically last anywhere from a few seconds to several minutes. First, let's talk about what exactly happens during a leg cramp. Although leg cramps can happen at any age, they're most common among adolescents and young adults between the ages of 13 to 20. However, they can happen to anyone. Before we dive into the most common reason why children get leg cramps, let's talk about the different types of leg cramps, because not all of them are the same. The good news is that these cramps are usually harmless and go away on their own. Fortunately, these cramps are usually not serious and can be treated with physical therapy and medication. One of the leading causes of leg cramps in children is dehydration. So what should you do if your child experiences leg cramps due to dehydration? Another way to prevent dehydration-related leg cramps is to avoid caffeinated drinks. If your child's leg cramps are caused by dehydration, you may also notice that they are more likely to occur during the summer months or after strenuous activity. Another common cause of leg cramps in children is a lack of physical activity. The good news is that this type of cramp is usually easy to prevent. In addition, you can try stretching the muscles in your child's legs before bed. If your child is unable to stand, you can also try a seated calf stretch. Leg cramps in children can also be caused by certain medications. It's also worth noting that leg cramps can be a side effect of certain medical conditions, such as chronic obstructive pulmonary disease, congestive heart failure, and peripheral artery disease. While it's not always possible to prevent leg cramps in children, there are some steps you can take to reduce their frequency and severity. If your child does experience a leg cramp, there are some things you can do to help them feel better. I want to leave you with this. Although frequent leg cramps can be concerning for parents, they're usually nothing to worry about. So I ask you, have you ever experienced leg cramps? What helped you feel better? Leave your thoughts in the comments below.